Good evening and welcome to APPNA webinar Ask the Expert. I am Dr. Haroon Durrani, Secretary of APPNA 2020. As the COVID pandemic continues, so does the relief effort of APPNA. The latest figures about COVID-19 worldwide, over 5 million people are affected and 328,073 have died. In United States, 1.55 million people affected and 93,860 deaths. In Pakistan, 48,091 people affected and 1,017 has died. These webinars are our effort to bring the community to ask questions to our experts. There is so much information and or misinformation on the social media. So we decided to provide this opportunity to our communities to ask questions to our expert. And as usual, this is going to have two parts. In the first part, we will have Chair Social Welfare Disaster Relief Committee and Chair Task Force to give us an update on APPNA relief efforts. And today we have a special guest, Dr. Arshad Rehan, who is a treasurer of APPNA, who is going to give us a little information about the impact of COVID-19 on small businesses and 501(c)(3) organizations such as ours. So let's get started. First of all, Dr. Aisha Zafar, who is the chair Social Welfare Disaster Relief Committee, and Dr. Sajid Chaudhry, who is the chair Task Force COVID-19. Let's start with Aisha.
Ji, Assalamu alaikum ji. Thank you, Haroon, for arranging this seminar today. So as you mentioned before, Sajid Chaudhry and I, we work together. I'm chair of the Social Welfare Committee and Sajid is the chair of the task force. We started from a very, it was a very humble beginning, I must say. About 6 weeks ago, jo hamari initial fundraising thi. For the entire weekend, we were only able to raise about $1,600, and we were kind of nervous about how we will be able to overcome such a major catastrophe, which was affecting not only USA, but also Pakistan. But Allah ka bada karam hai ji, over the last few weeks, we have been able to raise, our most recent count is $810,000. और इसके अंदर हमने basically we have divided the funds. We are providing food both in USA as well as in Pakistan, and we are also providing PPE. Sajid will give the details as far as the PPE is concerned. I'm going to tell about the food. As far as the food is concerned, we have initial focus was mainly on Pakistan. Actually, we were getting more donations for Pakistan as well. And abhi tak jo aaj humne count kiya, we have sent food to Pakistan worth $203,000. And we are working with various organizations here, which include Akuwat, Selani, Al Khidmat, Helping Hands, and more recently, jinke saath humne partner kiya, wo Hands hai, which is providing food in Azad Kashmir, and also with Shahid Afridi Foundation, and they will be starting the distribution from next week. जो change इस दफ़ा basically हुई थी वो ये था, in the past we used to get a lot of criticism from the members that we were focusing on the bigger cities जो Pakistan की थी, and we were not going towards the remote areas. लेकिन इस दफ़ा हमारा ज़्यादा जो focus है वो हमने remote areas पे की है. The very first place where we distributed food was in Quetta, और उसके बाद हमने वहाँ पे बलोचिस्तान का एरिया था, मस्तूंग, हमने वहाँ पे किया जो HTF के थ्रू किया, and then after that we went to Sindh. So, those were the areas we started from. Waziristan was another area, jo ke Khyber Alumni ne, they worked with us, and we distributed food there as well. The other request that we got from a lot of members was that people were concerned that Ramzan is coming, but what's going to happen to our communities, which is our Hindu brothers and sisters, jo Sikh community hai, Christian community hai. And fortunately, बहुत से donors who came forward. There is a big Christian community in Punjab, close to Wagah border in Badrapur. Food was provided there by Helping Hands, and then we did this in Karachi. उसके बाद मिट्टी हमने सिंध में किया. There is a very small community which is present in Balochistan. उनको भी हमने provide किया. So that is basically, where our again, we don't have our presence as such on ground, but we have to work with different organizations. And Dr. Saeed Akhtar is here, and he knows that during the time of earthquake, that was really the strength that, we acquired working or collaborating with other groups on ground. USA के अंदर जो हम लोगों ने इनिशियली शुरू किया था, तो इतनी ज़्यादा हमें रिस्पॉन्स यूएसए में फंड रेजिंग में नहीं आई थी. लेकिन नाउ वी आर गेटिंग माशाल्लाह, टुडे वी क्रॉस्ड द $100,000 फिगर वर्किंग विद ICNA फूड रिलीफ जो है, इट इज़ बेस्ड इन यूएसए, and we have distributed food in several states. We have Dr. Uzair is working with us from there. They've been very good partners. You basically just tell them in the morning or sham tak, balki agle baaz awqat it's within a few hours that food is distributed. Uske alawa, the other thing that we have focused on is that we have asked the chapters and the alumni that if you want to work with your local food pantries, because we have to show our presence to the community here that we are working with them. And that has actually been, we've had a great response to that. Chapters have gone and they have handed over checks, or they have handed over food to the food pantries themselves. And another thing that we are now encouraging is that we are asking in the hospitals that they work in, if anyone contributes half of the amount, we will match that amount so that they will serve food to the doctors, to the nurses, or to the paramedical staff. We've also had a lot of physicians who have actually gone out in their community. They have distributed masks and other such supplies. They've given them to the post office, even to people jo garbage collectors are aate hain. Some people have gone out on the street and they have distributed stuff to them. So that is as far as food is concerned. We are getting a lot of requests now in terms of financial support, because as the businesses and the offices are reopening, people are still very financially challenged. So that is the next thing that we will be working on. And we are looking at various organizations. There's an organization by the name of Project Pakistan. Also, Ahuat has requested that we support them in that. So that is something that you'll be, inshallah, getting more details on. And I'll let Dr. Sajid Chaudhry tell the rest. But I do want to acknowledge the executive committee, all the members and the donors of APPNA. And frankly, this has been, we are all volunteers, but it's been a big effort. And I appreciate Sajid's effort, especially because he does daily updates. I'm not Facebook savvy, he is, and he will get all the details, he'll get all the pictures. And it has been a great collaboration. And I'm very humbled by the fact that, in APPNA, we are coming together and we are working for a cause which is not only helping USA, but also Pakistan. So thank you for inviting me. Shukriya.
Thank you. Thank you very much, Aisha. Sajid, can you also briefly describe? Yes.
Thank you very much, Harun, for giving us the opportunity. As Aisha mentioned about the time that we started, it was like we just had $1,600 there for, I think, 2-3 days. And then it got picked up. And Alhamdulillah, as Aisha mentioned, we have collected donation over $100,000. And so far we have disbursed over $600,000 for PPE, food. And the third objective was to have the educational webinars, which are being done by Merit, APPNA Merit. Regarding the PPE, his program is almost completed. We started with providing PPE in USA. So far, we have supplied about $130,000 PPEs to our chapter, alumni, community members. And these were distributed in different states all across USA, including Alabama, Delaware, DC, Florida, Georgia, Illinois, Indiana, Kansas, Kentucky, Maryland, Minnesota, Missouri, New Jersey, New York, Ohio, Pennsylvania, Texas, Washington, Wisconsin. So it's like almost all across the country, USA, wherever our chapters, members, they are located. And for Pakistan, we spent about 98,000 worth of PPE, and those PPE, they were distributed to different institutions, including in Karachi, Lahore, Multan, DG Khan, Gujranwala, Rawalpindi, Gilgit, and Baltistan. As now in US, where curve is flattening and a lot of PPEs are already available in different areas, so we have stopped our PPE supply program in US. In Pakistan, we are still supplying to the areas wherever it is needed, and we get the request regarding the PPEs. I am happy to share with all of you. Just today, we got the news from Lahore, Punjab, that Governor of Punjab has recognized APPNA as health heroes serving people of Pakistan. So it's a congratulation and good news for all of us, APPNA members. And I would like to thank APPNA Executive Committee, my team, APPNA COVID-19 Task Force, Social Welfare Disaster Relief Committee, especially Dr. Aisha Zafar, who has been phenomenal in doing all the networking, coordinating, and organizing the distribution all among our members' chapters in Pakistan and USA.
Thank you.
As well as I would also want to thank our generous donors, our APPNA members, and the APPNA members volunteers on the ground. So it's overall, it's a team effort from all the APPNA members, donors, executive committee, task force, social welfare disaster relief committee. So APPNA is working as a one unit. So that's I just wanted to acknowledge all of that. Thank you.
Thank you, Sajid and Aisha. Thank you very much. Now we move to Dr. Arshad Rehan. Dr. Arshad Rehan is a treasurer of APPNA, and he is going to briefly give comments regarding the effect of COVID-19 on small businesses, including organizations 5031C such as ours. Dr. Arshad Rehan.
Assalamu alaikum, and thank you, Harun, for arranging it. Thank you, Chima Saab, Aisha and Sajid. I'll never tire of praising their efforts, because they've been tireless in their efforts. Or APPNA is helping as much as it can. I'm not an expert on COVID. I will talk, as you said, briefly about the impact the COVID has had on small organizations, be them charitable or small businesses. As we help you, you can see that APPNA has been helping the poor and the destitute of the society. But APPNA is, I'll just give you an example of APPNA. APPNA as an organization also needs to sustain itself. Usually APPNA's revenues come from limited sources, and those limited sources include its meetings and international trips. As you can very well imagine, it has been a tough year for us so far as well. We've had to cancel our spring meeting. APPNA's main summer convention has been canceled. We're not sure if the fall meeting will be held or not. The international trips have been canceled. So on a total, if you have to estimate something, even an organization like APPNA has a shortfall of about $500,000 this year. This is very significant for us, and like us, other organizations are suffering as well and looking at other avenues of generating revenues. Small businesses definitely are hurting. There is no business. I mean, either there's shutdown or lockdown, whatever you call it, here in the United States. And if some places are open, then there are no customers. So it has been an uncertain situation all over. Only the other day, I'm sure all APPNA members so far have received an email that we've sent that we are requesting their help, extra help, which would be very generous of them if they can help APPNA sort of bear with this situation, an act of God, if you will. Okay, we are able to sustain ourselves. If there was no APPNA, we would not be able to help professionally or materially or in charitable ways to help our fellow brothers and sisters and the broader community. So I'll take this opportunity on a selfish basis and appeal to all APPNA members to read that letter and see if they can help APPNA in whatever way they can. So I appreciate this opportunity, and I'm sorry I had to issue this appeal, taking advantage of this. Thank you very much. Inshallah, we'll come out of this situation. The situation will be over, and APPNA will be stronger than ever. Thank you.
Thank you very much, Arshad. And thank you, Sajid, Aisha, and Arshad. If you want to hang on, it is up to you. Otherwise, we are going to move to our second portion of the program. Our panelists today are, I'm going to introduce one by one, Dr. Saeed Akhtar. He is joining us from Pakistan, Islamabad. He is the founding president and CEO of Pakistan Kidney and Liver Institute and Research Center, Lahore, also known as PKLI. Professor of Urology and Transplant Surgery, epidemiologist and public health expert, Yale University, USA. Dr. Numan Ashraf, he's a psychiatrist and program director, Kansas City University GME Consortium, Ozark Program, Joplin, Missouri. Dr. Faisal Chima, he's an associate professor of biomedical science, associate professor of clinical sciences, University of Houston College of Medicine, Houston, Texas. He's a director of research, HCA Research Institute, Gulf Coast Division. And also he is president of Aga Khan Alumni Association of North America. Our special guest today, Dr. Umair A. Shah. He's an executive director, Local Health Authority for Harris County Public Health. Dr. Shah currently holds many leadership positions with respected entities like the National Academies of Science, Engineering, and Medicine, U.S. Center for Disease Control and Prevention, Trust for America, and Health Network for Public Health Law, Texas, and Texas Medical Association. Welcome all four of you to our webinar. I am going to ask each one of you to give an opening statements regarding the COVID-19 as you see it. Please keep your opening statement to about minute to minute and a half, and then we will start with the questions, starting with Dr. Saeed Akhtar.
Thank you. It's a pleasure to be here. And as a life member of APPNA, it's a great moment to be together. I remember 2005 when I could see Sajid and all the team sitting here. We all worked together. Aisha, Faisal was loading stuff from the New York port, Pakistan, and we were distributing in Pakistan. So alhamdulillah, it brings good memories. COVID situation is not good in Pakistan. And unfortunately, the way things are going with the lack of controlled public measures, which are essential in a healthcare system where there's no cure or vaccine for a virus. The only thing which is left is public health measures that sort of control an epidemic, and unfortunately, so we need to be more prepared for what may come, God forbid, in next couple of months, and I think I'm extremely concerned about it.
Thank you. Thank you very much. Dr. Faisal Chima. You are muted. Go ahead.
Everyone, thank you so much for having me here today. We all know that how the global trends have spread across the world over the last couple months. This has really impacted all aspects. Specifically talking about a few things. We all know about the challenges we all face about the testing, but more or less they are being resolved depending on where anyone lives. The personal protective equipment, which you all already mentioned, those are not the emergencies now anymore. There are several therapeutic options, which we will go into detail later, but there are antivirals, which are being come up with more newer clinical trial results. There are vaccines which are being worked up, and there is other convalescent plasma therapies which are available out there. So I think during the rest of the portion of this webinar, I'll be happy to answer any questions. Thank you.
Thank you. Dr. Numan Ashraf.
Assalamu alaikum. Thanks for having me on this panel. So I think I would echo whatever everyone else has said. It's a lot of anxiety that it has caused and kind of pushed us into our houses. There is some ray of hope now. We heard about Moderna, we heard about AstraZeneca. So there's some hope that the things will get better. Starting to get back to business, we're reopening. So a lot of challenges that are ahead of us. So I would say kind of it's a mixed state right now. The prior 2 months were more depressing. All the news we were getting were negative. So now we are starting to get some positive news in terms of the medication treatment available. So a little bit hopeful.
Thank you very much. Dr. Umair Shah.
Assalamu alaikum. So thank you so much, Dr. Durrani, for having me today join the panel. I am the Executive Director of Harris County Public Health, which is the county health department here in Houston. So it's 4.7 million people. And I'm also the health authority for Harris County. I'm also a lifetime member of APPNA, so I'm a very proud member of APPNA, and it's great to see some fantastic colleagues. What I just wanted to add, in addition to what you've heard from the different distinguished speakers, is that really from our standpoint, we're looking at this as 4 phases of this, this response. The first phase was the real monitoring phase, at least here locally, what was happening globally or elsewhere. Then we went to the next phase, which is a frenzy of activity of really trying to determine where the first cases were and actions and activities that needed to happen right away. Here locally, that included, for example, closing our Houston Rodeo, which is a significant activity here. Then the third phase was really slowing things down, working from home, and these orders to really get people to really help us flatten the curve. And then the fourth phase really is where we are now, which Dr. Chima and Dr. Ashraf particularly mentioned, was really about reopening and that stage that we are now. And I do want to just say that the reopening brings some additional concerns. Obviously, here in the US, all 50 states have now reopened, and here in Houston, Harris County, and in Texas, we've actually done a quite fantastic job of fighting this virus. But the concern we have now is an uptick of cases. And as Dr. Akhtar mentioned, and I do want to say this very carefully, is that as a practicing physician, I know that we are very much talking about healthcare, but this is a public health crisis. And we do know that as we do not have any antivirals or any vaccines right now or any therapeutics, that ultimately our way out of this right now, at least for the interim and for the long period of time, is public health measures of social physical distancing and certainly facial coverings and hand hygiene and sanitation, as well as certainly education and awareness and making sure people are following through with that. So I think those are critical pieces and why public health really needs to be at the forefront of whatever is happening. And so with that, Dr. Durrani, I'll turn it back to you. Thank you.
Thank you. Thank you very much. So my question to Dr. Saeed Akhtar is that Pakistan, as we know, was not able to effectively have a good quarantine measures. And in spite of that, we still see the number of cases in Pakistan is relatively low. Can you explain, I mean, how?
Yes. So I think, thank you. So I think, Harun, this is an illusion. The number of cases all depend on how many cases have been tested. So right now, I mean, despite our tremendous effort on the ground to convince government to test as many as possible, and a good example of that is like Germany, where they were doing like 50,000 cases a day, a test a day, up to 100,000 cases a day. And that's where they had a very, very high number, but very low mortality, because by virtue of doing more tests, they're able to isolate the sick people from other non-sick people. And the non-infected people became part of the workforce, and the infected people were quarantined. And as we know, out of that, like 80% were totally asymptomatic. They stayed home, recovered, and became part of the workforce. Unfortunately, in Pakistan, our social behaviors are extremely challenging. The writ of the government is extremely poor. The responses are not as scientific as they should be. So now so that's why we see less number of cases. That's not true, that there are truly less number of cases. It's just that we're not doing tests. If we do, say for example, and I'm following the pattern. So we have about 10% cases that come out positive. So for example, if I do 50,000 tests today, tonight, I will increase the numbers by 5,000 more people. Now coming to the deaths, I think we do have a less number of deaths, but that also is, see, we scientists are data-driven people. So if there's no data, we don't know what the hell is going on. Fortunately, I think the only big thing which is in our favor is our population is young. Number two, we don't live in communities where there are big central air-conditioned buildings with air recirculation, so viral load is not as concentrated as in ICUs and areas like in USA and Europe where there are nursing homes, so concentrated, susceptible people in one area under one roof, for example. Thirdly, the way our houses are built, there's a cross circulation and whatnot. Fourthly, I think the sunlight does have some factors, so maybe we have plenty of sunlight. So there's some sterilizing factor of the virus. I'm not sure if the temperature does make a difference or not, but I think time will tell that. So I think these are a couple of the factors that, but if you actually look at the trajectory of the disease, it is as vertical as it is in USA or it was in Italy. So I fear, as a scientist, we always fear the worst and do the best. So I fear that, worse is yet to come. And I pray to Allah subhanahu wa ta'ala that He may have His mercy on us. But the way people are just going out crazy for Eid shopping, it's just mind-boggling. I don't understand what's going on. So that's where it is.
Okay, thank you. Next question is to Dr. Noman Ashraf. The children growing up with this pandemic, I mean, this is unprecedented. They have not seen anything like that before. This is a unique experience to them. And keeping them inside home, and basically they're spending more and more time on electronic devices. Should we expect any increase in any of the psychiatric disorders in these children? What are the signs and symptoms that parents should be keeping an eye on?
Right. So, yeah. So if they're spending a lot of time on the devices, and also you have to see their ages. So you're talking about kids, but then you have teenagers, then you have younger children too. And there are two issues you're dealing with. One is they are anxious just like us. The smaller kids, they learn about COVID in bits and pieces from news. They may overhear your conversation when parents are talking, and then they have some questions. And then the teenagers, they know about it. And suppose you happen to be their parents who are the frontline workers, they know this disease, our parents can contract, and that can be deadly. So they're dealing with all this anxiety. And so you have to address that. That's first thing. And the other one that you said is how do you come up with a healthier way for your kids to spend time at home rather than spending most of the time on the electronic devices? So these both things, if they're spending a lot of time on the electronic devices, that can also give rise to anxiety. The signs you ask about, if they're losing their sleep, they're not eating proper food, again, they're getting irritable and snappy easily if you talk to them. So these would be some of the signs that you would look for if that's getting to that point. So for that, what we are recommending people to do is at least for the kids who are not teenagers, maybe under 10, 11, having a schedule works very well. If they're not going to the school, create a schedule for them. And I can just talk about one of the template with you. It'll take about 2 minutes, what kind of schedule you can have. So what we recommend them is to have the kid wake up around before 9 or around 9 a.m. And then the first half, we call it sort of getting active. So you brush your teeth, you make your bed, change out of your PJs, you put your PJs in the laundry. If you want to do a little bit of yoga, a little bit of jumping jacks, just give your body a little bit of boost in the morning. And then from 10 to 12, you want to keep it as an academic block. And we call it as the first block of the day. And in that block, we tell parents that electronics are not allowed. So some of the students would get their homework from the schools, have them do that homework. If they don't have homework, have them do some craft work, have them do work, spend some time on Legos, something creative that they can do during those 2 hours. And then you're at 12 o'clock, so it's a lunchtime, so you can give them 30 minutes to 45 minutes for lunch. And then if you have 15 or 30 minutes till 1 hour, then you can have them do some chores. They can help you out with the washing the dishes, wiping down the table, sanitizing stuff. So they're kind of active and they're part of like the family, and everyone is sort of engaged in doing some things. And then from 1 to 2, try to have a quiet time. Just mirror it what they have at a school. So you can call it a nap time. You can give them puzzles. You can give them a book to read. And from 2 to 4, we enter into another academic block. And in this block, we allow them to have electronics, but not to play games, but it needs to have some sort of academic domain. So they can use Khan Academy. They can use the PBS Kids. They can do some mathematical games, something that can enhance their academic side. And then from 4 to 5, we call it sort of getting outside of the house. You can take a walk with your family and spend some time with your family and play in the backyard. 5 to 6 is your dinner time. You have dinner with your family. And then the last 2 hours, 6 to 8, they can have access to devices at that time because they've already earned it. They worked hard throughout the day. They followed the schedule. The kids who follow the schedule, you want to reward them with this behavior. That's sort of the healthy nurturing. So for them, they can even have an extra hour and go to bed at 8:30. Otherwise, 8 o'clock, they should go to bed and follow the same routine. So if you follow the routine, then they're not going to have that much time to think about it. The anxiety will be less. And if, of course, the kids have questions, then you want to address it, sit down with them, follow their leads. Do not give them too much information. See what questions they have and then address them appropriately.
Good. Thank you very much. My next question is to Dr. Umair Shah. Harrison County is the third most populous county in the United States. As a local health authority, please tell us if your county in specific and USA in general was ready for something like COVID-19.
Yeah, thank you. So yeah, we are larger than 26 states, and we are by population, and we're also geographically larger than Rhode Island. So, you know, when we do think of Harris County, we think of us as a state. And fortunately, we're also sociodemographically very diverse. In fact, one of the most, if not the most diverse county in the country. And that really has a lot of challenges and as well as opportunities, right? Fantastic number of over 90 consulates, 140 languages that are spoken. But I think the challenge that we have here is that I don't believe anybody in the globe was ready. I think that's the first and foremost thing that we have to acknowledge. We have had a lot of warnings, though, and when I testified in Congress last year, I did talk about the fact that we have this real challenge in public health where we are underinvesting. In fact, we are not investing appropriately. And years back, we had talked through about with avian influenza and H5 and other kinds of different diseases. We were really concerned that we were not going to be ready for a pandemic unless an incredible amount of investment continued in public health. And unfortunately, what continued to happen is public health was de-invested over the years, and that has been a global phenomenon, unfortunately. But here in the US, that's absolutely the case. I would say, though, that we have in Harris County, because of the planning and the efforts that our teams had done and a lot of the activities post the 2009-2010 H1N1 mild global pandemic, which our department was responding for 18 months at that time, so a year and a half, we learned a lot of lessons and we put those in place. I would say that, again, we weren't ready to the degree that I wish we could have been. The underinvestment in public health has been a big challenge. But I will also say that Texas Medical Center, with our healthcare institutions, with Baylor and University of Texas, MD Anderson, and Texas Children's, et cetera, all the other fantastic healthcare institutions, means that we have been able to be very aggressive on a public health standpoint, while we've also had the real ability to have our healthcare partners really add capacity in the healthcare system, from beds, ICU, ventilators, et cetera, to the point where we have been able to manage this first several phases in in a fashion that's allowed us to be successful. And I know you have a couple of other panelists from the Houston area who can also vouch for that. But I think we have to remember with this virus that it is a novel virus, and none of us can have the hubris or the arrogance to think that we have this figured out. The moment we think we've got this ready, it changes in a heartbeat to another direction. And we have to be ready for the next stages and also what lurks around the next corner. So to me, it's always the tale of two cities, that we were better than where we have been, but we don't know what's ahead, and we have a long road ahead of us. And so I really think that that is really the way to look at this, because this has been a virus that has honestly broken all the rules that we have thought that we would ever really see related to how we would respond to a virus of this nature.
Thank you. The next question is to Dr. Faisal Chima. Faisal, what are some options, therapeutic options for the treatment of this COVID-19? Can you also comment on the current status of convalescent plasma therapy as well?
Sure. Thank you so much, Dr. Durrani, for that question. So I think before I delve a little into the detail of that, let me quickly share some of the visuals which Dr. Saeed Akhtar and Dr. Shah earlier mentioned too. If we look into the slide here, we see that, once it started off from Wuhan, slowly and gradually over the period of the next 3.5 months, it spread out across the globe. As the country's color is becoming darker, that is the number of the cases which are being increased. So this is something which is important for us to put it in the background, when we are talking about this entire thing. And then what Dr. Saeed Akhtar earlier mentioned, that, why in Pakistan specifically it was, not that much, or, it was primarily because of the testing. And the next slide here would detail about that. If you look at, the testing data, which can be done through the PCR or the antibody testing, but look on the left side, that is the number of the tests available or in these countries per 1 million patient population. And Pakistan was not even on the track, on the graph here, because that had less than 200 tests available per million population. Again, the countries which you referred to in the Europe, and in US, they had more testing available, and that's why we were able to catch those patients well ahead of the curve. Now, when we talk about the therapeutic options, there are going to be those, of course, as Dr. Shah earlier mentioned, they are going to be primarily public health measures, prevention and all that. Antivirals, and the reason I put up this slide and a couple more is just to let the message get across the masses that these are not the magic pills or magic, injections out there. This most recent clinical trial on Gilead and remdesivir, everyone is talking about. FDA has approved it for the compassionate use. It was done on 1,063 patients. That only reduced, no reduction in survival, that only reduced the hospital stay from 15 days down to 11 days in these patient populations. Now, at the same time, we have to give the credit where it is due, that, Gilead, of course, withdrew from getting any royalties, opened it up for 5 different companies to develop it and get the information out and the medication ready for 127 countries across the globe. But then again, we have to take these results with a grain of salt, that these are not magic solutions right now. When we talk about the vaccination as the other part of the therapeutic options, so vaccine can be of two kinds, preventive or therapeutic. In the preventive aspect, if you look at that, there are about 70 or so companies, which are currently working on vaccination. Involved in order to bring the vaccination out to the world, real world. That requires animal testing, so on and so forth. There are a couple of good candidates, and over the last week, we have seen, without taking the name of the company, but there are 2 really good companies that come up forward. They have shared some of those data, but remember, the news which comes out is like, we have found a solution to neutralize all kind of, viral load in these. But then when you look into with a magnifying glass, there are only a bunch of patients which were done. So companies which vaccination apparently is working was only tested on 8 in terms of sample size. So whereas preventive vaccine vaccinations are there, very good candidates are there. It will take another few months before we start seeing them in the massive. Then the other one is really about the therapeutic aspects of the, what we call it. And that is where the convalescent plasma comes to play the role. This is nothing different from the regular use in the hospitals where we either give the bloods or sometimes we give the plasma. So if you have to give the plasma, then if you look at this red person, which is here, that is a COVID-19 patient. He was positive. He recovered, he became green here. From the recovered patient, naturally, there were antibodies which were made in that naturally by our bodies against COVID-19. You can withdraw that and then give those viral antibodies to the patients who are actually suffering with COVID-19. And that could be a therapeutic option. Just to let you know that this trial with the convalescent plasma from Mayo Clinic, this started off as an expanded access protocol. By now, by this afternoon, 19,500 patients have been registered in that. And out of those, 14,000 patients across the US has received convalescent plasma. Results probably will be out there by mid-summer, but I think anecdotally, we are seeing that some of these patients have recovered from this. There are more revisions being done, but in a summary, Dr. Durrani, there are several therapeutic options from antivirals to vaccinations to convalescent plasma, and then now more recently immunomodulatory therapeutic options are becoming available as well. But going back to what the other panelists mentioned, that it is all about the public health measures which will help us win the game and get to the finish line. Thank you.
And thank you, Faisal. Next question to Dr. Saeed Akhtar. So when the experts are talking about that reopening of the businesses and reverting back to normal life, there has to be mass testing and there has to be vaccination available. Can you explain to us, how these two will work and where we are? Faisal alluded to some of the details, but where we are in the process and how long? And do you think that Pakistan has any chance of having mass testing and vaccination in foreseeable future?
Right. So in any epidemic, Harun, there are three slopes. One is the upward trend, then it sort of plateaus when it reaches the max, and then it starts to come down. So our objective in the upward trend or the upstroke, and that is also called acceleration interval in the epidemiological term. Our focus is to find out who is infectious and how can we contain him. Then it plateaus and comes down. So while it's descending down, that's the time when we start to see, okay, so how many people in the community are actually have been exposed to it, and that's where the antibody testing comes into the picture. As has been mentioned earlier, unfortunately, we are dealing with a virus that we know very little about. Does the antibody it produce, would it last long enough? Does the antigen outer surface that it has against which the antibodies are being produced, is it going to stay the same? There are cases in which we saw that the guy was PCR positive, and he became negative, then he became positive. Very strange behavior. So is it a multiple strains which are working? What do we focus against? And these are some of the challenges that we don't know what the answer to that is. So coming to Pakistan, number one, our PCR testing is extremely suboptimal, which is very, very sad. We are almost 3 months into the game, and our testing has not gone more than 10, 15,000 if at the best. And that is also recently. Number two, I don't think we are ready to do the antibody test as yet, because we have not started to go down on our downstream curve or deceleration interval. So it's extremely difficult to predict how things will happen. And on top of everything, what makes things even worse is the irresponsible attitude of people, like we are not going to see another day to shop or whatnot. Obviously, our needs are there. So I think we are failing on all fronts here, unfortunately, in Pakistan. All the public health measures, people are going into places without masks, because I think there's a lack of serious will on the part of the government and people who matter. See, the state is like a mother. It is their job to protect the people of the country. But here, people are just with very, very disgracefully irresponsible behavior are spreading the disease. I don't see vaccine coming to Pakistan. And I just wanted to add that, I think we need to just keep our hopes low with the vaccine for at least 1 year, even on the accelerated pathways, because these vaccines, and we know from development of vaccines in the past, as a student of epidemiology, that a lot of things can go wrong in a desperate moment when you're looking for a vaccine desperately. People do get vaccinated, but then they find out that there are some neurological symptoms coming up 2 years down the road and whatnot. So vaccine is no joke. Vaccine is a very serious business. And that's why, you can fast track it as much as you can, but you can't just say, okay, this is it, and then here we go. So I think overall, I come back to the same basics, that the mainstay of dealing with this catastrophe is through public health measures, social distancing, covering your mask, washing your hands, basic stuff. But I think we need to create will, and the will, and then the assertion of the law saying that, look at, we are opening things here, and look at what Kuwait and Qatar are doing, fines and jails and whatnot. See, you have to understand something, that two good example is Saudi Arabia and Taiwan. Taiwan learned the hard way through their SARS experience in 2002. Saudi Arabia and Middle East learned through their hard experience for the MERS experience. So these guys are extremely, tight in their control mechanisms, because they've seen it, and the people are sensitized to the deadliness of the virus, and we are very, very casual. So I think our job as health experts or health students is to sensitize people, and the government has to come up more firmly to push it to protect the people of the country. Thank you.
Thank you. Thank you. My next question is to Naman Ashraf. The healthcare professionals are in the forefront of this battle, and their morale is not high as they see their colleagues getting sick and even dying. What would be your advice to them to cope with these things?
So, so that's, that is the issue that we all deal with every day. And as I was saying, that can also be with the kids earlier, if people are in the front lines. What they can do in this time is they have to manage their normal routine of life. They have to get their mind off of what's going on. So that's the first step. And also they have to recognize what's going on. So if they suppose have some sort of guilt they're going through, if they have a fear of unknown, what's going to happen, like we were talking about, there's so many things that we don't know the answers of. If there are other things that are getting to them, they need to first recognize it. Now, and you have to find out what is the point. If they get to the point where it's really impairing them, then they need to seek help. So then you will go see somebody, you will do therapy, and you have to process it so you get it out of you, so it doesn't make you more depressed. But to avoid it, you want to have a healthier lifestyle. So what can you do? There are some coping strategies that we want to use that can keep your mind healthier. And I'll just mention 3, and then if we have time towards the end, I'll come back and I'll explain those strategies. But I just want to list some of the things that people can do to keep themselves healthier physically and mentally. So there's a progressive relaxation that we recommend that people should do. There's deep breathing. There's mindfulness, meditation, yoga, prayer. So all these are in the same category, and you can pick which one works for you. Every day, try to turn off the TV, if your phone or PC, and at least try to make 2 hours of technology-free zone. Try to do something healthier. Read a book, spend time with the family, but take yourself off of this, because if you're watching the news all the time, then there is now, there are mixed news, there's some hope, there's depressive, but a month back, this was all bad news. It was all sad. People are dying. That is increasing. So that's why it's important to you swap your 1 or 2 hours of news for something maybe lighter, maybe a comedy hour. Maybe at night you just swap your 1 hour of news to the comedy hour. Call your friends, your family regularly. Talk to them. Take a walk. If you cannot go to the gym, do some exercise at home. Go for a run. Try to eat a healthy, regular diet. That's very important. That's going to keep you healthier. Or if you do not have anything, suppose it's Saturday, Sunday, or you got furloughed and you're at home and now everything is coming back to you and your mind is stuck in that anxiety. Try the coping strategy. They're not working. You want to pick up something? Organize your room, organize your office. Pick up a hobby or get back to your older hobbies. If you're a musician, write music. If you're a poet, write poetry. If you like some sort of sports, anything that you can do with social distancing, try to do that. Golf, whatever works for you. And then self-care is very important. Even if you are off, say, over the weekends, and you get up, you should try to take a shower. You should try to change from out of your PJs and your sleeping clothes. You want to feel as normal, even if you are furloughed and at home, and maintain your routine. So keep yourself busy. And if you get to the anxiety, try to do some coping strategies like the deep breathing meditation. And if that doesn't work and you really get depressed, then you need to seek the professional help. Talk to someone and process those feelings.
Thank you. Thank you. Next question is to Dr. Umair Shah. Dr. Shah, we hear about reopening of businesses. What are some most important factors considered for reopening, and what can ordinary people do to help expedite that?
Yeah, thank you, Dr. Durrani, for that question. And this has been what's been on the minds of everyone across this country, at least, has been reopening. And now we have 50 states, all 50 states in some level of reopening, some markedly more advanced, some that are just starting, some that have really been in their infancy, but reopening is now the name of the game. And I think there are a few things that I'll give maybe a Texas perspective, and then try to zoom out a little bit beyond the thought of what reopening really entails. One, from a Texas perspective, first of all, our governor made actually issued some orders that essentially what it did was took it out of the hands of locals. So local health officials like myself, local elected officials had put in orders, and those orders were essentially overridden by the governor in the state of Texas. That actually has been happening across the spectrum throughout other states as well. What that has done, though, is that there has been instead of having a ceiling for the kinds of activities, there has now become a floor for the activities. Or let me reverse it, that's how we've had it. Now we actually have a ceiling to our orders so that it's actually now a floor, which means that large urban communities like ours are now being treated almost as if the rural communities where you have less population density, and they've all brought to a common level. Why that's important is that as we reopen, there are a few things that we've been saying to our establishments, and this goes to the global question across the country and beyond, is that just because a business or an establishment needs to reopen or can reopen doesn't mean that it has to reopen. That's the first thing. The second is that just because a customer or an individual in the community can go into an establishment doesn't mean that they have to go in to that establishment. And where we're very concerned, obviously, are those who are over the age of 65, those with chronic health conditions. We're very concerned that even in those instances where we're still saying maybe you shouldn't actually go to these establishments because you are at higher risk for the complications that have come with COVID-19. The other thing that we're saying to individuals are that you have the decision to make, that just because you can go to any restaurant or you can go to any hair salon or you can go to any business does not mean that you should just go into those without taking a good stance and look at the health protocols that are in place. If you have two establishments, one that is actually following the health protocols, social distancing, queuing lines, making sure that you have distance within the restaurant, let's say, or the food establishment, or you have the facial coverings on the workers, you have hand hygiene, you have all the different kinds of preventive measures in place, and you have another establishment that does not. We're saying to the individual, vote with your feet, make a decision to go to the establishment that has those protocols in place. So I think reopening is a very difficult balance. The balance is that on the one hand, we've got economic and socioeconomic considerations. On the other hand, we have health and safety. And what I've been saying now in the media for the last several days is there is no reason you can't have both. This is not an either or, it is an and. You can open up businesses and establishments, but you can also open them up safely and with a health lens in mind. And if we do that, that gives us the best opportunity to be able to really respond to this next phase. But again, establishments have their role, but also the consumer, the customer, the individual also has the opportunity of making the best decisions as they get through those this next phase.
Okay, thank you. Thank you. The next question is to Dr. Faisal Cheema. So in the beginning of this process, we were talking about peaking. The curve is going up and it peaks. Now we started talking about flattening of the curve. So just explain to us briefly what it actually means, flattening of the curve, and then what is the next thing that we have to look for in the process, in the disease process, that would be reassuring for us.
Sure. Thank you so much, Dr. Durrani, for that question. I think in very layman terms, the flattening of the curve probably means that, from the previous day or the previous time when it was measured, there's no further increase in the cases per period of time. So, but what is more important is for the masses to know that flattening the curve means flattening the risk for the disease or the complications coming out from COVID. We have seen that the patient populations which were not previously, or the population, age-based population, which was not previously at the high risk, are now turning out to be at higher risk for COVID-related stuff. So let's start off from very young children. It was thought that the young children would not get COVID, or they were completely risk-free from this initially, early on, about up until April. Then we saw that in the late April, the first case of a child suffering from a Kawasaki-like inflammatory disease was published. A known published case was from Stanford. Then this week, we've seen that, statewide, New York has reported about 64 cases. Then we have started to see this syndrome in children in Italy, Spain, UK, and other places. As the time goes, there will be more and more reporting of those. Children are, coming up with gastrointestinal problems. They are having some other issues with their thickening tongue and veins and all that. Then the other patient population, which was previously known as very safe and resistant from that, was the young or youth, or the not very old people. We have seen that COVID has had impact on thrombosis. In other words, in layman terms, people can have strokes. Younger people are presenting with strokes, and there are several studies now going on. NIH and NHLBI and other federal agencies have actually, in fact, invited some research groups who've been working on the blood clotting to come and do research on this. So again, the point which I'm trying to highlight is that the patient population which were previously thought that they are not prone to COVID, they are developing COVID, the other thing really is the psychosocial impact of this whole entire disease as we further move along. Dr. Nomanich very elegantly and eloquently, went over the details of how we can continue to make strategies that we can, have less and lesser impact of that. And then, some very relatively minor, but there are reports from the cardiac manifestations or the heart problems, associated with that. So what we have to be careful is that as a flattening of the curve is happening, no doubt about that, one danger is, when the opening happens, the resurgence of that. So, and the second thing would be the flattening the curve does not mean the risk for people. So we have to continue to be extra careful. You might have seen my wife just passed behind me. She had a mask on her face. I did not plan this in the video, but it just so happened we have to be careful with all of these measures.
Dr. Durrani, I think you're muted.
Sorry about that. I muted myself. So we are running out of time. We have only a couple of more minutes remaining, and I would like each one of you to give a very brief closing statement, starting with Dr. Saeed Akhtar.
First of all, thank you for having me here, and I think it's extremely valuable information that you have provided. I just want to say that a good example for me is state of Kerala, 35 million population, and they only have 4 deaths. And all they did were extreme degree of public health measures. Country like us, no big hotshot technology and stuff like that. So again, I think I go back to the fundamentals: prevention, 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 till the time we have medicine and till the time we have some vaccine.
Thank you very much. Dr. Numan Ashraf.
Yeah, well, thanks for having me. And I would just want to say, as I said earlier, I'm still hopeful we'll find a cure. We have to do it. We've done it always. May take some time, and people should follow the social distancing in the meantime. Follow the guidelines by your government, whatever they've given you. And inshallah, we'll be able to find something soon.
Thank you very much. Dr. Umair Shah. Just go ahead.
Yes, thank you. Again, thank you for having me. And I just want to echo, I think this has been a fantastic panel. I think the one thing that I would just close by saying is that we're in this for the long haul. This is not a sprint. This is a marathon. And unfortunately, this is going to take many turns. I will say this is the most studied virus in the world right now. And the strategies to fight this virus are also being increasingly shared across the globe. And what that really means at the end of the day is that we are going to be shifting and pivoting from different actions and strategies as we learn from others. No community in the world has gotten this correct. There are some that have gotten close. Kerala was mentioned, New Zealand was mentioned, other parts of the world have certainly done a fantastic job. But I do think we have to recognize the humility that we should take as we fight this. And ultimately, it's all about us working together, healthcare, public health, and certainly with our community. We can't do it without everybody continuing to stress the messaging of prevention until we get to eventually a therapeutic or a vaccine. Thank you.
Thank you very much. Thank you very much. Dr. Faisal Chima.
Well, first of all, Dr. Durrani, I would like to thank everyone in APPNA and ICNA to hold this seminar for the public awareness. I'd like to quote Quran, وَإِذَا مَرَضْتُ فَهُوَ يُشْفِينِي from Surah Shura, that when we fall sick, only Allah gives us the heals us. But at the same time, the same Quran invites us to read and gain knowledge and apply that. So whereas the public health awareness message, which Dr. Saeed Akhtar and Dr. Shah has given so eloquently, is there. There are therapeutic options which are in the process, and with the scientific development, we will get there. But this will be a long haul, as Dr. Shah mentioned. It's a marathon. We are all in it. We all have this responsibility, shared responsibility.
Thank you very much. Thank you, gentlemen. This concludes our webinar. I thank you again for joining. Khuda Hafiz. Good night.